Hello everyone, my name is Bendok. I'm chair of neurosurgery at Mayo Clinic in Arizona, and it's a real honor and privilege to be talking to you today from Los Angeles. The Mayo team here is representing the broad Mayo Clinic neurosciences here at a neurosurgery conference, the American Association of Neurological Surgeons. I'm here today with my dear friend and colleague, Dr. Robert Spinner, who's chair of Mayo Clinic in Rochester. So we represent two of the three sites of the national Mayo campus, so to speak. The third is Mayo, Florida, with Dr. Quinones, who also is at this meeting but couldn't be with us here at the moment. So I'm really excited to be here with Dr. Spinner. Dr. Spinner, in addition to being chair of neurosurgery at Mayo Clinic in Rochester, is an internationally acclaimed surgeon who is an expert in the treatment of peripheral nerve diseases, tumors, and other peripheral nerve pathologies. He's really considered one of the foremost names in this field, so it's a real privilege to be sitting with him here today to hear how the meeting has been going for him. So I'm going to ask him a little bit about that, but also about how this meeting is important to Mayo Clinic and to the advancement of knowledge. So on that note, Rob, great to have you here today, and wanted to just hear your thoughts on how this meeting is going and what you found to be interesting.
Well, it's a great meeting. It's great to be here. Dr. Quinones just walked in, so why don't we introduce him on camera? Good to see you.
This is Dr. Quinones, chair of neurosurgery at Mayo Clinic in Florida. And between the three of us, you now see really this represents the vision for Mayo Clinic, neurosurgery and neuroscience, to have three campuses as one national clinic, so that any patient in North America is usually no more than an hour flight away from Mayo Clinic. That's the idea, so that if you happen to be close to Minnesota and Rochester, that's terrific. And if you prefer to go to Florida, that also works great. And if you happen to come to Arizona, we'd love to see you there as well. And some people divide their time between the Midwest and Florida, and the Midwest and the Southwest, and that also works for people who live in two places. We do a lot of work between the three of us, and our chair is Dr. Fred Meyer, who's the overall chair of Mayo Clinic Neurosurgery, the enterprise chair, and also the dean of the medical school. We do a lot of work. We meet about every other week to talk about ways to learn from each other. Dr. Quinones is an internationally acclaimed expert in brain tumors and neuro-oncology, and as I mentioned, Dr. Spinner specializes in peripheral nerve tumors, and I specialize in neurovascular and skull-based diseases. So between the three of us, we really cover a lot of neurosurgery. We have been working over the last several years to assemble great teams. And again, we're here at the AANS in Los Angeles to do several things. One is to engage with our colleagues within and outside of Mayo Clinic on new knowledge, new expertise, and new innovations, but also to share some of the things we've been learning at Mayo Clinic about how to advance each of our fields. So along those lines, it's really a great pleasure to be here with my two colleagues, and wanted to start by talking to Dr. Robert Spinner about how he's found the meeting and what's been interesting. And Dr. Spinner's given a number of talks at these meetings. Perhaps you could share with us some of the things that you've been sharing with the overall AANS audience.
Well, it's always good to be here with the experts in the field, but also to interact with neurosurgeons who are trying to learn from us in what area we specialize in. At Mayo, we're very specialized, as you know, and in Rochester, as in your campuses, we all have experts across the field. So in certain ways, I'm a bit of a dinosaur in your field, but fortunately I have experts in your field that you could collaborate and talk with, and that is what makes this fun. And I think when we get together, we have this expertise that really is the spectrum of neurosurgery. So this has been an exciting meeting for me in peripheral nerve. We have a big dinner tonight. We have one of the highlights is the Klein Lecture tonight, named after my mentor, David Klein, and one of my fellows won the Klein Award, so he's giving his lecture tomorrow on that. We're having a dinner tonight. So these sorts of interactions amongst friends really make this fun, and seeing you guys on stage or not makes it even better.
And what would you think in the last 12 months or last year, what is maybe the two or three most exciting advances in peripheral nerve surgery that you're sharing here at the AANS that you perhaps share with the audience?
Well, I think nerve transfers for injuries is really one of the biggest things that we're doing. The results are improving, so short-term and long-term outcomes are getting better, and new people are thinking of more creative ways to spread that. Nerve tumors and the imaging related to that's really exciting. So now, for example, at Mayo, we're going to have the first 70 clinically available MR, which is really going to show peripheral nerves at a fascicular level. So really getting to the microanatomy of everything.
That's terrific. We also have Dr. Quinones here with us today. Dr. Q joined us about a year ago?
About 8 months ago.
8 months ago.
Not even a year, but we already feel like it was only yesterday.
Yes. Well, welcome, Q. It's been great to have you join the team, so to speak. And tell us how you found the AANS meeting and what you're excited about and what's new in the brain tumor world.
Well, I tell you what I am excited about is about these type of meetings that I get a chance to spend time with you guys, honestly, and to see a lot of our campuses, especially Mayo, being part of organized neurosurgery. All the 3 campuses, Rochester, Florida, and Arizona. And I'm always excited to see the advances that are going on in vascular and endovascular and peripheral nerve and brain tumors. And one area that we actually have, all of us have expertise is in spine diseases, and complex spine diseases, all the way from oncological disorders. So I get to see, a lot of exciting developments, and I would say that gets me excited to come here, be part of this, and then to hear about the advances in brain tumors. Number one, it is becoming clear that the more you can take out of the tumor in the operating room, the better these patients do. But to be able to do that, you got to do it in a safe manner. That means that you have to understand the physiology, map the brain, and I know all 3 of us do a lot of awake craniotomies where we get to map the brain. That is becoming evident. A lot of the data is being presented at this meeting. Number 2 is the fact that there are new methods that have been approved by the FDA, for instance, electromagnetic fields that we can actually use, and we have available at our campuses to be able to treat our patients with these special helmets that allow electromagnetic forces to stop the migration of cancer cells. And I think a lot of that data is being presented at this meeting. So that all together allows us to have hope and give our patients hope. And I think that's really what Mayo is all about. And obviously, being here with you guys in this venue makes me really excited.
This is a very exciting time for Mayo. We're all building across the enterprise, so in Arizona, Florida, and Minnesota. I think one of the other nice things about this meeting is with the industry companies here, it's an exciting time for us to see how Mayo should best invest in technology, which is something that you've alluded to. But I think also as we're growing, we need future partners to fill and add expertise in other new areas. So investing in talent is one of the things. So these meetings really allow us certain opportunities like that go beyond the things we were talking about.
We have some new recruits, as you know. I mean, I think that Dr. Spinner can tell you a little bit more about some of the exciting people that he's bringing, not only in spine, but also in brain tumors. And we're doing the same thing, I know, at your campus. A lot of new recruits that you have brought in, people that you interacted with through the years, the top leaders in the world, the next generation, young surgeons. We're doing the same thing in Florida. And we get to exchange ideas at this meeting between all the campuses, in addition to the fact that we do it, as you said, every couple of weeks. So that's what I'm really excited about.
Yes.
And what about you?
Well, so, the Arizona is the relative new kid on the block, so to speak, in this 3-campus setup. And we're really excited. Over the last years, we've upgraded our technology. We've opened up an innovation and simulation lab to design new devices and new approaches, but also to simulate operations before they happen. So one of the things I'm really excited about, and we see this happening at all 3 sites, is for patients to send us an image of whether it's a brain tumor, a peripheral nerve tumor, or a skull-based tumor, say a pituitary tumor, or a scoliosis or spine problem, to print that or to render it holographically, to study it with our colleagues, whether it's a model, our nursing colleagues, or the larger team. In the Mayo Clinic, we like to work in a team, so it's nice for the team to not just look at a 2D image, but to look at the 3D model, or to hold the hologram, and then beyond that, to actually operate on the hologram. So that we can, before a patient comes to Mayo Clinic, we can actually not only understand their disease in a very individualized way, but also consider the operation, get better at it, and maybe consider the different options. Let's say one option is to coil the aneurysm, and the other option is to clip the aneurysm. Well, why don't we try both and come up with not just a gut feeling about a 2D image, but actual objective findings from operating on a model. So the idea is to print the patient and to do the operation before the patient even arrives to Mayo Clinic. So when you arrive, we'll actually have a video or a model that we've already actually have a lot of insight into your pathology and how we should treat it. And I think this approach also opens up the door to new innovations, because we may print the pathology and realize we don't have a terrific solution for this, so we need to work with our industry colleagues or engineers or scientists to design a better treatment. I think that's one of the ways we're really excited. One thing I'll add to that is the idea of telesimulation. So the idea with telesimulation, we're going to be able to take Dr. Quinones' expertise and bring his hands via simulation, overlay them on my hands so that he can actually give me his knowledge and wisdom in my operations. This idea of with augmented reality and virtual reality, we can actually, now we've become 3 campuses, we're actually going to, even though it may take us a couple hours to fly to each other, we don't need to fly. We can be at each other's campuses via virtual reality, augmented reality, via avatar kind of approaches. So that's really going to, and one other thing that'll do, I think, is also connect with our international audience and international patients. We're working on some technologies now that Mayo Clinic is about to roll out that will allow us to connect with patients overseas in South America, the Middle East, etc., where we can actually have meaningful interactions beyond just telephone before they even arrive to Mayo Clinic. I'm really excited about those approaches.
I think what you were just talking about is a great example of the needs of the patient coming first, but advancing education and research at the same time.
Yes.
And in fact, 3 sets of hands virtually become 1.
Mm-hmm. Right. And Mayo Clinic, since the Mayo brothers, was all about sharing that knowledge, exchanging that knowledge. The Mayo brothers traveled extensively to pick up wisdom and bring it back to Mayo Clinic. And again, I think, Rob, what you just said is probably the most important statement of this whole discussion, is that Mayo Clinic, our most important value is the needs of the patient come first. So we're always trying to challenge each other to see how can we do that a little bit better.
And one thing that you mentioned actually at the beginning, the first thing that you said, that you're like the new skin on the block, but I think that maybe people don't realize, and I want to make sure that people know that already in Arizona, the Mayo Clinic is considered the best hospital in the state of Arizona. And that is something that is a testament of the vision and mission of the Mayo Clinic. You know, it's something that we don't take for granted, because it's a responsibility and a power that we take very seriously.
Yeah, and I think, you know, and Dr. Quinones, you worked at another medical institution before coming to Mayo Clinic. How have you, and Dr. Spinner has a long career at Mayo Clinic and a great passion for Mayo Clinic, and which you have now embraced. Tell us what you found to be the differences between practice at Mayo Clinic and perhaps at other medical centers. Yeah.
I would say that I was very happy in my prior job at a major academic center, a major university, and people said, why do you make the change? And I tell you, for me, it was what I like to joke around this, it was a no-brainer. When I came to meet the people at the Mayo Clinic in Florida, when I went and visited Arizona, when I went and visited Rochester, I got re-energized. I got recharged with that passion of caring for patients, with that vision that the needs of the patients come always first, and the fact that all the work that goes in the 3 chills, patient care being at the front, research and education, that the research and education is also important, but it's important as long as it continues to enhance the experience of the care of the patient. And when I saw that, I felt that this was the place where I was meant to be, you know, for the rest of my life in my career. And that's exactly the difference that I see. A lot of places do a great job in research. A lot of places do a great job in research. Very few places do great job in taking care of patients and at the same time doing good research and doing good education to enhance that experience. So this is my experience now with the Mayo Clinic. I embrace it. I value it. I am extraordinarily happy and honored to be part of the family.
And you, the same thing. You were at another major center, and you've embraced the Mayo culture even better than some of the people who were born into it.
Well, you know, I think the Mayo culture is a lot of fun, actually, because I, by nature, if I was a musician, which I'm not, I would probably like to be in a band and not be a solo artist. So I really enjoy the interactions that Mayo provides. Mayo Clinic really is an idea that if you bring a team around a patient, around a problem, you're probably going to get a better result. And that's what I've really enjoyed, that networking amongst my colleagues, because at the end of the day, especially with the way knowledge is growing, no one doctor can know everything. And so the key, as you know, my grandmother always said, surround yourself with people who are smarter than you are. And I think that's the secret sauce of the Mayo Clinic. And, and Rob, for you, what you know, you've been at Mayo Clinic for a while. You have a long history and a successful history at Mayo Clinic. two questions. One, what keeps you excited after all these years about being at Mayo Clinic, and why do you think the model has been so successful for so long? Many things, a lot of technologies come and go, a lot of fads come and go, but the Mayo Clinic model has proven the test of time. What do you think keeps sustaining it over the decades?
Well, I think the first question is easy. This is such an exciting time for Mayo. We're growing in Rochester, we're growing in Arizona, we're growing in Florida, and then we're growing incrementally across the United States and internationally. So I think the integrative approach makes this an extremely exciting time for us and for science and medicine. I think the other aspects now make it even easier. I think, Mayo, the integrative nature of interdisciplinary, multidisciplinary care surrounded by experts in everything, not just in medicine but also in science and now in education, makes this an even more exciting time for Mayo as we extend our brands across the country. I think now for education, we had a small medical school. It's so exciting to see that small, excellent medical school now is extending to Arizona and in big plans for Florida. So this is a great time. Your medical school's opening up, in 2 months?
Yeah, we have our class lined up in a couple months from now. So it's a beautiful campus that I wish I had such a beautiful campus to attend when I was a medical student. On that note, I think thank you both, Dr. Q, Dr. Spinner, and
we have some questions.
And we'll take some questions now.
Are there any advancements in neuro-oncology?
Any advancements in neuro-oncology? Yes, absolutely. Thank you for that question. I think that we are in an exciting time in neuro-oncology. Number one, we know that taking as much tumor as possible in the operating room is crucial for not only survival but for quality of life of patients. We know that the experience of the surgeon and the surgical team is extraordinarily crucial. That means that the more experience your surgeon and your team has as a general, as a major tertiary care center, will make the experience of the patient much better as well. We also know that there is a new and exciting time in checkpoint inhibitors and in immunotherapy that are allowing us to fight cancer in the brain, not only primary cancer but also metastatic that comes from other parts of the body to the brain. These checkpoint inhibitors and immunotherapy are allowing us to fight better and better, and I think that over the next 5 to 10 years we're going to see major extension and survival of our patients. And the last one is cellular therapy. I think, and I go back to regenerative medicine, which is one of the priorities of Mayo Clinic. We now know that our own bodies have a lot of ability to fight diseases, one of them being cancer. We know that in our body there are stem cells not only in fat but also in the bone marrow, and the Mayo Clinic is leading the way in making this a reality. That means that we're engineering cells as a personalized and individualized medicine, so that way we can put it back in our patients and try to fight cancer. And I think that we're 2 or 3 years away from making those results available to the public, and I think that that's what gives patients hope.
And I think the other part of that, you were talking very nicely about sort of the treatments, but I think even the preoperative diagnosis or the intraoperative management and even the postoperative surveillance all relates to imaging. So now we have these new, bigger, better ways of seeing tumor, even better than our own eyes by far. So I think this facilitates how we manage patients through their course at the Mayo Clinic.
I just looked at some technology that's coming soon that allows us to look with a little fiber optic camera at the cells in the wall of a tumor cavity.
Amazing.
Down to the cell level, and I think that's going to be a big advance. Thank you, everyone, for joining us. It's been a real honor and pleasure to be with you here from LA at the AANS. Thank you.
Thanks.